I'm delighted to be with you today. Myself and my colleague Steve Martin are here to talk to you today about how we can effectively engage with governments and how can we ensure that our voices get heard and how we can then support behaviours to change. So over the next few minutes, we will give a bit of background and then we will end up with a discussion between Steve and myself, and then we'll hand it over to you to ask us any questions that you may have. But before we begin, I would really like to say that as patient advocates, you really have the role in raising the voice of the patients you represent to the public and to healthcare professionals and to governments. Governments will listen to you. They need to hear from you. But we have to make the case to governments for this to actually happen. And we know that globally and nationally and regionally, governments are the gatekeepers for investing in your care and in health system policy reform. And health system policy is what we call to be the rules of the game. So our role in policy and engaging with governments is to try and help them understand where those rules of the game need to be enhanced or strengthened to ensure that you as patients or as carers receive the best care and treatment that you can, that's led by the science and by global consensus and global guidance. So if we break that down a little bit sort of more simplistically, this means that investment by governments informs not only the people who get treated, but also how diseases are managed and then how that care is delivered. So all of us, whether we are patient advocates, whether we work in the pharma industry, whether we're healthcare professionals, we all have a role in the respiratory community to help shape the policies and the government agendas to ensure that patients receive the best care that they possibly can. But why should governments really care? They have so many competing priorities. They are being bombarded with requests from many different areas, and it's very difficult to get your voice heard. So we're going to spend some time really looking at these competing thoughts and these competing priorities that governments have. And we must also be mindful that we are living in a world where respiratory diseases are actually at the top of the government agenda, thinking about the COVID-19 pandemic that we're all living in at the moment. And thinking about what governments are going to be looking for, they are going to be thinking about how do we ensure the financial sustainability of our health systems as we move forward. And so how can we demonstrate the cost effectiveness of actually looking after and maintaining your health compared to going to hospital visits and using emergency departments? So the importance of actually maintaining your health and ensuring you can access the right treatments at the right time to ensure you can take control of your own health. And then also COVID-19, we have seen a dramatic uptake of telehealth over the last sort of 9-10 months. And it's a way of delivering healthcare that in a previous time would have taken decades to have achieved. But we are really at a moment in time where we should really harness this, because this again can reduce burden on the bricks and mortar of healthcare systems and ensure that patients get fast, quick access to the physicians and the nurses for help and support. And we also know that we're seeing a real growing of patient empowerment, which can then also again help reduce costs. So how can we demonstrate again that improved respiratory care will improve outcomes and then also ease the pressure on health systems? And how can you as advocates and carers, how can we help everybody empower themselves to take better control of their care? So the more we align what we want to actually achieve with the priorities of the government and align that to the benefits of society, then they are more likely to be listened to and be heard. And then we think about, well, governments actually do need evidence. Policymakers need evidence to understand that they are actually delivering and making decisions that are the right ones. And what evidence can we use? Now, some of you may have already seen a patient charter that was published a couple of months ago for severe asthma, and that sets out a degree of quality standards that patients should actually deliver or should actually receive, and it should be delivered to them from the health system. The other way of evidence that we have is published patient charters, which are a set of aspirations and quality care that patients should really demand. And you may see during the time coming up for World COPD Day and beyond, the work that GAP have led to develop a patient charter for COPD. And we would really say that the elements within this patient charter are going to be a really strong advocacy evidence base for you to be able to use and work into your ways of advocating and supporting and informing change at a health system level. And you may also have heard of this formula, what we call the 3 E's and an R. Tonya may well have already shared with you before, but it's a formula that we can use to really help ensure that we cover the right elements when we're engaging with governments. And these are evidence, emotion, economics, and relationships. And evidence and economics are absolutely crucial in building the confidence that the change that we are requesting or trying to support is one that's going to benefit society as a whole, health systems as a whole, and the governments as a whole in meeting their agendas. So they need local evidence that drives that local decision, and they really are looking for real world evidence. And as patient advocates, you also have a role in supporting the development of real world evidence. But then also they need to feel emotionally connected to the disease or the area that we're trying to elevate in their priorities. And respiratory disease really hasn't got the attention of governments before. COPD is the 3rd leading cause of mortality around the globe, and that really isn't understood or recognised by governments at all. But in this time, with COVID shining a light on the importance of managing breathing and respiratory health, now really is the time where we can really drive that emotion to ensure that asthma and COPD and other respiratory diseases are at the forefront of governments' minds. So we really need to try and build on that compelling emotional side. And then importantly, policymakers and governments are people, and relationships are incredibly important. It will take time and it will take a concerted effort, but by developing and understanding what's driving them and being able to work on that strong relationship will build trust over time. And so those sort of 4 elements really can try and drive the way you formulate your outreach to governments and to policymakers. I'm going to hand over to Steve in a minute, because this is a formula, but what we're really trying to say is they also need to change their behaviour in understanding this is important. So it's all very well having the right formula and the right evidence, but we also need to think about how we communicate and how we can affect that behaviour change. So I'm absolutely delighted to be able to hand over to Steve to take us through some more behavioural science and when we're trying to engage with governments and policymakers. Thank you, Steve.
Well, thank you very much indeed, Anna, for the invitation to join you at today's event. I'd like to talk for a few moments about the psychology, the science behind how we can be heard. I recall in your presentation, Anna, you used this idea of how to be heard, how to influence, how to affect change a number of times. And so I'd like to talk a little bit about the evidence base that sits behind how we can successfully arrange for our important messages, our important propositions to be heard, and so that they do have an impact. So let me start by talking about, I think, an intuitive appeal that all of us have when it comes to the ability to successfully influence and change others. And it's this idea that says that if we have the right information, if we have the right evidence, and that information and evidence is supported by good economic data, then those 2 things are going to be crucial to the successful influence of others. Those 2 things, information and economics, are the things that are going to move people's minds. Now, I don't doubt that these 2 things are important, as Anna clearly talked about this idea of having evidence on your side and being able to communicate the economic benefits that support your evidence are crucial. But all of us have also had situations where we've had good evidence, good information to present to others, and it's still fallen on deaf ears. And there's a reason why it falls on deaf ears. It's because sometimes having information and economics alone isn't enough. The reality of our world is that we live in a highly complex, uncertain environment where our audiences, the people we're looking to influence and persuade, are overwhelmed with information. The reality is also the case that our world is socially intertwined. What we pay attention to, what is important to us, what we decide to focus on, is often a matter of context rather than content. And so as a result, I think it's important to recognize that successful influence, our ability to ensure our important messages are heard and that they do affect change. We don't just simply rely on evidence and economics, but we also ensure that our messages appeal to a fundamental set of human motivations that decades of behavioral science research show can be really important and really central to whether or not our message is heard and acted upon. So during the course of this few minutes that I have with you, I'd like to talk a little bit more about three fundamental human motivations that our research and research of many other behavioral scientists show to be crucial when it comes to successful influence and successful change. And these three motivations are accuracy, connection, and ego. If we can arrange for our evidence and the economic data that supports our evidence to also align to one or more of these three fundamental motivations of human decision making, we increase the likelihood that our messages will be heard. So briefly, when we talk about accuracy, we're talking about people's motivation to make the seemingly correct or right decision. And often they have to do that when they don't necessarily have all the information to hand and that there are conflicting priorities. Secondly, all of us have a motivation to behave in ways and act in ways that affiliate and gain the approval of others. So if our decision allows us to gain the approval of others, to be connected to them, that increases the persuasiveness, the attractiveness of that particular message. And finally, all of us are motivated in some way to see ourselves in a positive light. So what I'd like to do is I'd like to offer up three examples, one for each of these motivations, how sometimes the use of a small change or a subtle shift in the context or way in which you present your evidence and your data can make a significant impact on people's likelihood to listen to it and act upon it. So first, let's look at this concept, this fundamental motivation of accuracy. Now, one of the things I've been doing over these last 2 or 3 years is researching this concept of what I call messenger effects. Sometimes it's not what's said that matters. It's actually who says what is said that matters. Let me give you an example. This is a study that was conducted in a healthcare context that demonstrates how the way in which we introduce people and the way in which we ourselves are introduced makes a fundamental difference. So in this situation, this is a study done in diabetes clinics. Patients are newly diagnosed type 2 diabetic patients. And in this first condition where the data has just been displayed to you, in this condition, the diagnosing doctor reports to the patient that because of their condition, they're now going to go and have to have a series of appointments with the diabetes nurse and some nutritionalists. And the doctor simply says to the patient, go make those appointments with the receptionist. These people will be important in the ongoing treatment of your diabetes. And then the researchers measured the confidence and satisfaction they had in both the doctors and subsequently the nurses that those patients saw. And as you can see in this standard condition where, doctors simply say, go see the nurse, the vast majority of the confidence and satisfaction held by patients lies still in the domain of the doctors, not the nurses. But in a second condition, the researchers instructed the doctors at the point of diagnosis to point out why those nurses, why those nutritionalists were experts in their own right. So the doctor would say, I'd like you to go see our nurse, our nutritionalist now. Both of them have decades of experience in managing type 2 diabetes. These are the people that are going to be in the best position to advise you on the ongoing treatment and management of your condition. And look what happens to the impact of that message. The confidence and satisfaction in those nurses and those nutritionalists rockets. And we know from research that the extent to which we are confident in a messenger increases the likelihood that we will listen to them, that their messages won't fall on deaf ears. So my first recommendation is, don't just think about the messages that you are presenting to those people in your audiences that you want to influence and persuade. Think carefully about who is the best person to deliver those messages. And also, if it's you, how your expertise, your legitimacy, your credibility is introduced before you deliver the message. It's clear from decades of research that often it's the messenger rather than the message that increases the likelihood of influence and change. Let's move now to our second motivation, the motivation of connection. As I said, all of us are motivated to behave in ways in which we are able to gain the approval of others and connect with others. And again, there are some simple ways in which we can increase the likelihood that our messages will be acted upon by appealing to this fundamental motivation. So in this particular study, doctors were shown X-rays and CT scans of patients. And in one condition, they were just shown the X-ray or the CT scan. But in another condition, the researchers clipped a little passport-sized photograph of the patient to their CT scan or X-ray. So what they did is they humanized, they added a face, a character to this information. And doing so had a significant effect. Those doctors that only saw the CT scan without any photograph, on average, recommended 3 subsequent treatment options and further tests. Contrast that with the same doctors that were given the same information, but in this instance, the photograph of an individual patient was clipped to the CT scan. They more than doubled the care and the number of recommendations that they actually made. And so here is the implication to us as communicators. We need to ensure that the good evidence, the good economic data that we are presenting that is supporting our case has a face. Any way in which we can humanize our data, our information, and create that connection, that social glue that holds us all together is going to be really, really important. And as you can see from this data and others, it can significantly impact the likelihood that our important messages will be heard. And finally, the ego motivation, this desire that all of us have to behave in ways that align to our fundamental commitments, our pledges, our self-ascribed traits. And so one way in which we can increase the likelihood that our important messages are heard is to align them to pre-existing commitments or self-ascribed traits that the people we're communicating with have deemed to be important. If we do that, then that allows them to fundamentally satisfy that ego motivation. So one last example from, again, a study conducted in this time in hospitals, where the researchers wanted to see what messages, what communications most influence doctors and nurses to wash and sanitize their hands between patients. In one condition, what they did was above the gel dispenser in the treatment rooms, they put a sign that said, "Gel in, germs out." Had no effect. So they tried another message. They tried a message that said to doctors and nurses, think about the personal consequences and the risk to you if you fail to sanitize your hands between patients. Again, no effect. But in the third condition, they prompted doctors and healthcare professionals with a reminder of an oath that all of them take when they graduate, the Hippocratic Oath, the pledge to first do no harm. And when they were reminded of that pledge, you can see from the data here, they were significantly more likely to then subsequently take action and act in this patient protective way. So there we have it, 3 fundamental motivations of human behavior, the emotive characteristics that give us opportunities to bring our important evidence-based messages to life. So let me just leave you with this short summary, a bit of a conclusion, if you like, which is to notice that frequently it's not the message itself, the content of the message, the evidence or the economics that influences a change in people, but rather it's the way that the message is presented or the way that it is framed. So anything we can do to think about how we can frame our messages in an emotional, compelling way, I think is going to be super important. And this doesn't necessarily require us to do lots of big, expensive, costly changes. Notice the clipping of a patient picture or the reminder of a previous promise that a doctor had made, or the way in which we are introduced or we introduced others before we deliver a message. These are small changes, they're costless changes. And none of them came from the environments or the organizations where they were studied. We instead looked not to best practices, to what the cutting edge behavioral science tells us about successful influence and persuasion. And that, I think, would be my concluding remark. You have some very important messages to convey to decision makers. But having a compelling message is not the same as making your message in a compelling way. And I think the combination of the evidence and the economics that Anna outlined, coupled with these insights from the psychology of successful influence and persuasion, together, I think could make for a powerful set of approaches and strategies to get your incredibly important messages heard. Anna, back to you.
Thank you, Steve. I mean, that was so fascinating, and I do really enjoy listening to you, because it really makes me feel that as we're living in this digital way, being able to not just have a compelling message, it needs to be delivered in a compelling way, especially when we don't have that in-person connection. We're doing it over Zoom the whole time. So being able to try and think more about the way you're delivering as well as the content you're delivering is going to be ever more important as we're trying to influence and support and inform. So, I mean, the first thing I'd like to ask really is that, you know, as we are thinking about delivering our messages in a compelling way based on the evidence and the economics, what other common pitfalls are there, or even misconceptions that we want to sort of avoid when we're trying to influence and affect and inform change?
Yeah, I think this is a good question. It's an important question, Anna. And I think for me, there is one, it's a kind of misconception. It's also it's a pitfall as well that many of us fall into when we seek to get our message heard. And that's that we kind of fall into the trap of thinking that in order to influence people successfully, to change them, before we actually do that, we first have to change their minds. And as a result, that kind of compels us to, present lots and lots of data and information. But what we find in the research is that information alone is in fact a very poor set of tools for influencing. And in fact, I go one stage further and to say that actually we don't necessarily have to change people's minds in order to change their behaviors and their actions. I think sometimes it's much more efficient and much easier to go straight for those actions. So sometimes less is more in these instances. We don't have to give all the appropriate information. We need to kind of think about what is going to be the most important information and align it to, as I suggested in the talk, one or more of those handfuls of, universal motivations. There are only 3, that accuracy, that connection, that ego. So I think that is a common pitfall. We think that we need to kind of educate people into change. And I don't think that's always the case.
I think that's really insightful, and it's such an easy pitfall to fall into. I'm just thinking of all of us that are trying to advocate. We get very passionate about things we believe in, and can often fall into the pitfall of giving too much information and too much data. So we might leave our audience and the people behind who haven't got that instinctive passion for the area. So I can feel myself, I've probably fallen into that pitfall one or two times, actually, as too much data and not picking the compelling piece and delivering it in a compelling way.
Me too.
Um,
Me too. We all do it. It's a common one. We all, even if we know about these things, it's very easy to fall
it's
into them.
very, yes, but it's a good point to keep in our mind, is that choose the right piece of data and deliver that compellingly. Um, Leading on to that, then, if you got an example of where an organisation has done this really well, I don't know whether it's a government organisation or a commercial organisation, but an example of where you can think, that was done well. Have you got an example at all?
In fact, actually, I've got several examples. It does strike me that if we think about governments, whether, wherever they are in the world, the individuals within them do seem to understand intuitively the influence and persuasion process. And one of the things I've noticed about really successful influencers and communicators, actually more generally, is that when they go into a situation where they want to be heard, where they've got a request to make of someone, they almost invariably don't start from a place of who can help me. Instead, what they do is they start from a place of how can I help others, or what can I do for someone else first? And it actually makes really, really good sense if you think about it, because all of us from the earliest ages are brought up to abide by this social rule of you give back to others what they have given to you first. If a neighbor does you a favor, you do the neighbor a favor. If a colleague at work helps you out with something, you're more likely to help that colleague out. There's a kind of reciprocal connection to
Mm.
how communication and influence works. And so one of the things I've actually noticed, Anna, is that the masters of the communication and the influence process, they tend to adopt that stance first. They don't go into situations thinking, who is going to listen to me? They instead think, who could I listen to first? Or what could I do for someone first that creates that kind of reciprocal exchange between people? And so I've actually noticed that they 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 don't move straight away, or first of all with their agenda. They seek first to kind of connect with others and help others first, to build almost like an obligation, such that the person then that they want to influence and communicate with is more likely to be receptive to that message. They choose their moments, and sometimes they set up their moments. That to me is really, really instructive. What we do first at the very beginning of an interaction often shapes the whole of that interaction and the likely output of it.
Thank you. I mean, that makes me think back to the relationship piece that I talked about in my 3 E's and an R. If you can build that relation, then it's going to hopefully then build that two-way reciprocal environment where they are more likely to want to support and help. I'm now just sort of thinking about how we can bring this back to our audience and our respiratory audience. And I think I mentioned it earlier, and it still makes me feel quite uneasy when I think that COPD is the third leading cause of mortality, and yet people don't even know much about the disease, which is one of the reasons that we're so glad that GAP has taken the lead on developing this patient charter, which sets out 6 clear principles about wherever you are in the world. If you have got COPD, what can your carers or your family or even yourselves do to be able to try and ensure that you're getting the right care? Are there some practical things that we can do that would really help support, elevate the elements of that patient charter?
I absolutely think there are. And I've read that patient charter, and it strikes me as a very comprehensive, very sensible, very clear and well set out document. Although one of the challenges, I think, when we talk about the prevalence of a condition and the many hundreds, thousands, tens of thousands, sometimes millions of people that suffer from these conditions, is the people themselves often get they become discarded. They get lost in the statistics.
Mm.
I think it was Mother Teresa that actually said, if I just look at the mass, I won't act. And actually, there's some really instructive science behind that. There's some good research in, it's called actually the individual victim concept. This idea that if we talk about hundreds of thousands of people that suffer from a condition, it's actually less compelling for someone who can do something about it to actually act. But if we talk about the individual victim, the individualized sufferer, if we bring them to light and connect those important considerations, those 6 points in the patient charter, to real lives, to real people, that creates a much greater compelling proposition. We humanize it in exactly the same way as those studies that were done where doctors were much, much more likely to attend to, they were more caring, they recommended more tests when they saw a picture of that patient clipped to their X-ray or CT scan, rather than just the plate, the digital image. It was humanized. And so I think that's one really important way, Anna, that we can actually bring this important set of protocols and desired outcomes that are outlined in that patient charter to life, to humanize them. If there's one thing that I would actually recommend about essentially anyone can do to increase the likelihood that their message will be heard is to make it more human, to build on that emotive and emotional characteristic of the story. And note that the emotion comes before the evidence. So we create the human connection and we back it up with evidence. I think sometimes the mistake we make is we go in all guns blazing with the evidence and then try and kind of shoehorn an individual or a human story into it. I think the important thing is to just do that in the other order, do it in reverse order, emotion first, evidence second. And I think we might, all of us, find ourselves in situations where our important messages are perhaps being attended to a little bit more closely.
Oh, that's just fantastic. I'm worried that we're out of time for our discussion, Steve. But I think ending on that bit about bringing the emotion before the evidence is going to be music to the ears of the advocates that are listening to this, because they are emotionally connected to this. So before we hand over to the live Q&A, I would just like to thank Steve and thank you all for listening. And I hope the two models that we've just demonstrated today, the evidence, economics, and emotion and relationships, backed up with a way you can compellingly deliver that message using the A, C, and E that Steve really outlined, has given you some confidence that you as advocates are the ones that will be able to really drive change. So on that, I'm going to hand over to you, and if you've got any questions, please ask away now.